Hi, I'm Katt. I'm an upper extremity surgeon with Orthopedics. I'd like to talk to you about Dequervain's Tenosynovitis. This is a condition involving the tendons on the thumb side of the wrist. This condition is an irritation of the tendons that move the thumb. This can be extremely painful and can occur after a traumatic event, repetitive activity, or of uncertain cause. Typically, holding your thumb away from the hand, bending the wrist away from the thumb, or forceful activities such as grasping, hand and thumb motion typically cause pain, especially with forceful grasping and twisting. People of all ages can suffer from tendonitis across the level of the wrist, although it's typically seen in young mothers and middle-aged females. Quite often, the diagnosis is made with a history and physical exam. X-rays are not often obtained. The treatment for tendonitis across the level of the wrist in this area typically involves avoiding the aggravating activity, taking anti-inflammatory medications on a short-term basis, and splinting the wrist and thumb to provide rest and protection. If these treatments are not effective, a cortisone shot can be effective in decreasing the swelling around the level of the tendons. Cortisone injection provides only short-term relief where multiple injections need to be given. Surgery is considered. A tight band is noted on the outside of the wrist near the thumb. The tendons must pass under this tight band in order to go toward the thumb and hand. Swelling of these tendons can cause a sticking as they pass under this band. The operation involves releasing the band to give more room for the tendons. This operation is typically done on an outpatient basis. Typically, local anesthesia and also sedation are given. A small incision is made at the level of the wrist, and the band is released to free the tendons. Inflamed tissue may be excised as well. Typically after the procedure, a splint is applied, and 7 to 10 days later, the stitches are removed. At that point, a brace is used for comfort and activities can be restarted. It typically takes 4 to 6 weeks after release for complete improvement.